Well,
Hi, I'm Carissa O'Brien, the Social Media Community and Content Director at Aetna. Carissa O on Twitter. So we just wrapped up a session on leveraging the power of online communities and defining the role of social health. And so we had a really interesting discussion around really what gets folks engaged in the conversations and connections that social brings, and what motivates some of that behavioral change. Had an interesting conversation around patients and the patient community and how their story evolves over time and matures from one of being helped, being the patient, to then helping, so sort of maturing into a patient advocate role, which I think was really interesting, and I guess not something necessarily new, but kind of put a fine point on it for me to kind of explore that journey and how folks make that transition and when it happens and how it happens and why, because I think there's some real power in that. We talked a little bit about the brand influence and what role they can effectively have and what is really acceptable to the patient community as sort of being a resource and fostering connections and highlighting important and valuable things in the patient community rather than being an imposing force, which I think is certainly a valid point. What else? We had a really good dialogue. I think there are some good perspectives shared and certainly some opportunities to better tap into the power of social. So I think the future of social health is certainly one that's quickly evolving, and I'm looking forward to continuing to be a part of it.